You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
And today we are tackling a topic that is unfortunately very timely. It is all over the news. Everyone's talking about it. Measles and, of course, the MMR vaccine. And we have with us today an expert, Dr. Adam Ratner. I'm going to read his bio in just a second, but he is the perfect person to bring on the podcast to talk about this topic. Thank you so much, Dr. Ratner, for joining us.
My pleasure. Delighted to be here.
All right. So without any further ado, let me read. Dr. Adam Ratner is a pediatric infectious disease specialist. He's been on the front lines of both measles and COVID-19 outbreaks, helping lead responses and care for hospitalized children. He's also the author of Booster Shots, an absolute must-read, which we will link to on our show notes, in which he warns of the resurgence of measles, the anti-vaccine movement, and how we can prepare for the next pandemic. Before we dive in, I just wanted to read a couple of quotes on the back of the book. Two of my heroes are quoted here. So Dr. Paul Offit, not only have we largely eliminated measles from the U.S., we've eliminated the memory of measles. As a result, measles is coming back. Weaving historical events with personal experiences, Dr. Ratner makes us remember, telling us exactly what is at stake if we continue along this path. And then Dr. Peter Hotez, we had him on the pod, total personal hero of mine. In many parts of the world, we're seeing the return of measles because of interruptions in childhood immunization programs, but also because parents are refusing to vaccinate their children. In Booster Shots, pediatric infectious disease expert Dr. Ratner informs us on what we must do to get back on track and the potential for global eradication. Wow. All right. So, Dr. Ratner, I was joking before we started, but I mean, it's like you had a crystal ball. Like, who knew that this book would be so timely?
Yeah, I started writing this about 5 years ago, even before the COVID pandemic started. It was, in the wake of the 2018, 2019 measles outbreak in New York City, which, we can talk about more. But, I thought that at that time, the measles story was fascinating and told us a lot about what was going on, not only in the communities that were affected by that outbreak, but nationally and globally. And, my thought was, well, this could be a problem going forward. Obviously, at that time, I didn't know that COVID was coming, and that changed how I wrote and how I thought about this and had no idea what was coming beyond that.
And COVID was interesting because it impacted the uptake of other vaccines, right? There were interruptions in the childhood vaccine schedule. Also, we're seeing a real uptick in vaccine hesitancy, a lot of myths and misconceptions around vaccines, which there are many around COVID vaccines, but then it bleeds into these other childhood vaccines. And we're definitely seeing rates decline. We're seeing exemptions increase across the country. And at the time of recording, so we're recording this on February 25th, Dr. Ratner, we were talking about this, I think. So there's an outbreak currently in Texas, which is also spilled over into New Mexico. I don't know if we have confirmation that there's a direct link, although it's safe to assume.
Right. It's thought to be a link. I don't think that there's been confirmation of that yet.
Right. About 100 cases right now in Texas and New Mexico. That number, if you've been tracking it, that number has been exponentially increasing. And then we believe there's been there's talk of an exposure to potentially thousands of people. Dr. Ratner, I think you said you heard something about this.
I don't have confirmation of this, but I heard that there were exposures on college campuses. I don't know, and we won't know for a little while whether there are secondary cases as a result of that. My hope is that most people on those college campuses would be vaccinated and so would be protected.
Okay. And then there are little pockets. I think there are 3 cases confirmed in New Jersey, at least 1 case in New York. Again, we don't know if they're linked. But measles, honestly, scares the poop out of me. So,
And rightly so.
am I correct, Dr. Ratner? Is it the most infectious, contagious virus, disease that we have, that we're currently aware of?
It is number one. So anything you can think of, it's more contagious than flu, it's more contagious than COVID, it's more contagious than polio, it's more contagious than Ebola. Like it is unbelievably good at moving from person to person. And some of that is that it's efficiently transmitted through the air, like some of the other viruses I mentioned. It can linger in the air for a long time. So up to 2 hours after someone is in a room, if you're susceptible, you can go into that room and get measles. And if someone with measles walks into a room full of people who aren't vaccinated and haven't had measles before, about 90% of the people in that room will get infected.
Wow.
It is no joke.
So as contagious as we thought COVID was, and it is very contagious.
Oh yeah.
Right.
How would you compare measles with that?
Yeah, so we use this quantity called R naught as a proxy for how infectious things are. There are a bunch of assumptions based into that, including that you're dealing with a totally susceptible population and people aren't taking efforts to decrease spread, like masking and things like that. So the early estimates for COVID's R naught were in the 2 to 4 range. Polio is like 5 or 6. Pertussis, which is super duper contagious, is like 8 to 10, and measles is somewhere around 16 to 18.
Wow.
Like it is far and away the most contagious thing we know.
That really puts it into context.
Yeah.
So a comment we get all the time, well, there are a few things, and we're going to pick your brain about a bunch of them. But the first is, well, I've never seen anyone or known anyone who's had measles. Hello. That's
Why do you think that is?
exactly. And actually, you have a fantastic chapter in here called Making Nothing Happen. And we always say, public health is a victim of its own success. And so, you say here, vaccines are masters of making nothing happen. So can we talk about that a little bit?
Yeah, I mean, and this isn't unique to vaccines. This is, as you said, unique to everything in public health. Like when I'm a pediatrician, and so I take care of kids in the hospital. These are kids who are sick. I want to help make them better, of course. But I think the primary goal of pediatrics and of most of us in medicine is to keep people from getting sick. And vaccines are one of our most important tools for that. Like up there with clean water and clean air. Like they're that good. And if you look at childhood death rates from a century ago and you look at them now, it's they're obviously much, much lower. Some of that is sanitation, but a lot of that is also vaccines. You look at what kids died from 100 years ago. It was diphtheria, it was polio, it was measles, it was all of these things. And vaccines help us prevent those. And then, the thing is, though, what does it look like when you prevent a disease? It looks like nothing. It just looks like regular life, right? It's a healthy kid who's going to school and doing all the things that they're supposed to do. You don't get to know which kid, that kid would have had diphtheria and not made it past their 5th birthday. No, that kid just gets to grow up, and that's fantastic. But we end up with a population full of people and parents who, through no fault of their own, have never known anyone with measles or polio or things like that. And so they reasonably, I think, start to say, well, why is this such a big deal?
All right. Well, Dr. Ratner, another thing I hear is, well, isn't it just a rash? So how would you respond to that? How does measles actually manifest? What are the signs and symptoms, prognosis, all that good stuff?
So there is a rash. What I will say about measles, the thing that was most shocking to me during the 2018-2019 outbreak in New York City, which I had seen a handful of cases of measles before that, like returning travelers and stuff. But I was in the peak of it, we were seeing 4 or 5 kids a day with measles in the hospital. And these kids were miserable. Like even if you ignore the ones who were really, really sick, who ended up in the intensive care unit and needed ventilators and stuff, like those guys were obviously sick. But even the ones who weren't that sick, who came into the emergency room and just needed to be evaluated, they're miserable. Like high fevers, rash all over the body, kind of starts on the neck and the face and then spreads down and then out to the extremities. The eyes get really red. The light hurts the eyes, so they're in a fair amount of pain. It's, for most kids, that's sort of the natural history of measles. They're better after about a week, which is great. And then afterwards, they're immune to measles for life. And so that's wonderful. And that's most kids, but it's not all kids. And I think that's where some of the disconnect is. Like, we were at a point before the measles vaccine came out where just about everybody got measles as a child. So it became this thing, measles is a rite of passage. It's just something that kids get and they get better.
Wasn't it that if my dad was always saying when he was a kid that if someone in his class got chickenpox, they would expose everyone in the class to him so that they would just get chickenpox and then they would be immune forever. They would get over it.
Yeah, which is rolling the dice. Most kids will do fine. Before the chickenpox vaccine, we had about 11,000 hospitalizations a year from chickenpox and a couple hundred deaths a year. So it wasn't, at the scale of a country, it wasn't, a huge number of deaths, but those are a couple hundred real kids. Right, not at that time.
Not at that time, right.
Not when I was a kid, but now, yeah.
Right.
I mean, and, same thing with measles. It was, a few hundred or 1,000 deaths a year in the U.S. Before we could prevent it, sure, there wasn't really anything to do. But now we're in a situation where we can prevent it, and it's hard to predict who those kids will be. Another thing that I hear a lot is, those are just kids who are malnourished. Those are kids who have immunodeficiencies, and just up front, those are still kids.
Thank you.
But even if you accept that line of argument, it's it's not always those kids. It is sometimes kids who do not have malnutrition, and just are on the unlucky side of things. We see this with flu. Every single year we have kids in our hospital. My colleagues have kids in their hospital. Previously well kids who are unvaccinated who die of influenza. And it's terrible.
Mm-hmm.
And it's preventable.
Right.
Like, the flu vaccine isn't perfect. People can get the flu if they have the flu vaccine, which is why there's such poor uptake of the flu vaccine. But it's really good at preventing you from ending up in the hospital or dying.
Right. I'm so glad that you brought up, these are still kids. Like, people are playing very willy-nilly with children's lives. Like, and it's not like, it's like, it's just a couple hundred deaths. Excuse me? Like, tell it to their parents. Like, are you...
The best number of childhood deaths is 0.
Exactly.
And we will never get there because you can't vaccinate against car crashes. You can't vaccinate against, all of these things that aren't infections.
Yep.
So we should prevent the ones we can prevent.
Right. So can we talk, so you brought up the outbreak in New York, was it 2018 to 2019? I believe, and please correct me if I'm mistaken, that it was it was within a contained faith-based community. Is that?
Yeah, so there were 2 linked outbreaks. There was one in New York City, mainly in Brooklyn, in an Orthodox Jewish community, and one in Rockland County, which is north of New York City, and similarly in an Orthodox Jewish community there. And there's a fair amount of communication between the 2 communities.
And then sort of similarly, now, I believe...
the current outbreak.
The outbreak, was it within a Mennonite community?
Yeah.
Is that correct?
A Mennonite community in Texas, yeah.
And so we do see, right, there does tend to be higher levels of, exemptions, right, within certain religious communities. So a lot of the comments that we're receiving, though, are like, it's in a contained community. So like, why are we concerned? That's number one. And then number 2 is, well, if you're vaccinated, if your kid's vaccinated, why do you care? Why do you care? If it works so well, why do you care? So how would you respond to those things?
There's a lot in those questions, man. All right. So first of all, so it's just a contained community. Why do we care? Well, A, because we should care about children regardless. B, because measles anywhere is a threat to people who are not vaccinated. And there are plenty of people who are not vaccinated, not because they've chosen not to get vaccinated, but we give measles vaccines starting at about a year of age because that's when it works best. And that's when we have safety data for. And so kids under a year of age are, for the most part, susceptible to measles. So they're at risk. There are kids and adults who get chemotherapy and can't get the measles vaccine, or may have lost their immunity either from vaccine or from having had it before because of the therapy they're getting. There are kids with immunodeficiencies they can't get the measles vaccine. So there are all of these people who, even if they really wanted to get vaccinated, or their parents really wanted to get them vaccinated, for whatever medical reason, they wouldn't be able to. And then the measles vaccine, like all vaccines, like all medical everything's, is not 100% effective. And I mean, this is just the way it is for anything in medicine. So we recommend 2 doses of measles vaccine. That gets you to about 97% of people having long-term protection. That's great. And it's all you need in a population. If you vaccinate as many people as you can, and you have that 3% failure rate, you stop transmission of measles in the population. And what you've done, if you've stopped transmission, is you've protected those people who, the couple percent of people who may not have fully responded to the vaccine.
Mm-hmm. Right.
And now for measles, because it's so contagious and so infectious, we need a really high level of herd immunity, right? Of people getting the vaccine in the community. I believe it's set around like a minimum of 95% of the population.
That's about the line that people draw. It's, it sort of depends on a number of factors, population size and mixing and right. Stuff like that. But yes, we aim for 95% or better for MMR vaccination. We usually look at kindergarten entry as the sort of the indicator for a community. But it was interesting, like in the 2018-2019 outbreak here, if you looked at the New York City rates of vaccination, we were at like 97, 98% for the city as a whole, right? And then if you looked at the specific communities that were affected, it was like 80%. And so the problem is that you're a data person, we collect epi data and we aggregate it in certain ways. And you can miss something if you look at state level data or even city level data. The Gaines County community in Texas that has the outbreak now has an MMR vaccination rate of about 80%. Texas as a whole is at like 93, 94%, which isn't where you want to be, but it's also not 80%. And so, yeah.
We received 8 million questions for you, but a few things while we're talking about MMR vaccines. So you're talking about, yes, there are 2 doses. The first dose is typically given, 12 to 15 months. And then when is the second dose? Is it
4 to 6 years? We say it's usually at kindergarten entry, give or take.
However, and please correct me if I'm mistaken, you can get that first dose as early as 6 months. And the second dose can also come early. I believe it just has to be, 28 days after the first dose.
Yeah. So we don't do that routinely because, the regular schedule that is set up, the thing that we safety test and stuff is for about a year. The reason for the year is that that's when the vaccine works best. And that's when we have the most safety data for. You can give it safely down to 6 months. Often during an outbreak, they'll push it down to 9 months, but not to 6. Mm-hmm. There are places in the world where it's routinely given at 9 months because there's a lot more measles circulating, and protecting that 3 months worth of kid is really important. It's less of an issue if you've interrupted transmission in the country as a whole. Mm-hmm. So during the outbreak here, and I presume this is what's going on in Gaines County, though I don't 100% know that, one of the first recommendations was anyone in that 9 months to a year category can get their first MMR. We don't count that one, and so they end up having to get 2 after that, but it gives protection during that.
Now, for adults, there are a lot of adults who are like, I can't find my immunization records. I'm not sure. Yeah. And what if, if you're living in Texas, you're concerned, like, what if it's waned, my protection is waned, should I get another dose? So what would your guidance be for adults?
Yeah, so the CDC recommendation, which I think is reasonable, it depends a little bit on risk. So what they say is that for anyone who's a healthcare worker, for example, where there's always a chance that you'll come into contact with someone with measles, you need 2 doses. And so that's someone who either needs to have positive titers or have gotten 2 doses in the past. So, anyone who's a doctor, a nurse, a respiratory technician, whoever in the hospital. If you are traveling internationally, CDC recommends a second dose for everyone. If you're not in those, and I get kids going to college, things like that. And then if you're not in any of those groups and you've gotten a single dose in childhood, which is just about everyone who was a kid up until about 1990. So in 1989, 1990, we switched over to the 2 doses. If you're a 1 doser in that early time and you have minimal risk, then CDC is okay with the single dose. If you're living in or near a community where there's an outbreak going on, I would say, talk to your doctor, get a second dose. Probably.
Right. And correct me if I'm mistaken, sorry if you just said this. I think if people are born before a certain year, they have presumptive immunity, just because, as you were talking about, at one point, measles was quite common. So there's likely exposure.
Yeah, so we used 1957 as a cutoff for that, even though the vaccine came out in 63, just because of when you would have been a kid.
Right.
Based on that. So if you were born 57 or earlier, the assumption is that you had measles. You can, if you're in a riskier group, if you're a healthcare worker or something, they're still going to either do titers or just give you an MMR, even if you're in that group. And then there were a few years right after licensure where there were 2 measles vaccines out there. It was like polio. There was a killed vaccine and a live vaccine. We now use only the live vaccine. It turned out the killed vaccine was just, had fewer side effects, but was also not as effective as the live vaccine. And so the CDC recommendation is to revaccinate people who got the killed vaccine. But a lot of people, and that was a small number of years, and a lot of people who were kids during that time may not have a record that includes exactly which vaccine they got, of course.
Got it.
I have a question. Now, obviously, our listeners know that Jess is our resident data scientist, and we have Dr. Ratner, who's a clinician. But I'm over here, I'm a basic scientist. So my question is, what is the measles virus exactly? Like, let's take a step back. We've had a really good discussion about vaccinations and what's going on at the population level. What's going on at the individual level? Like, say I'm in a room with someone with measles, and they sneeze or cough, and I'm close to them, having a conversation with them, and I breathe in. What's going on inside my body?
Oh, it's so very cool.
Oh, I suspect it is.
Yeah. So you as with COVID, as with flu, anything like that, you inhale measles virions that are suspended in the air. They make it down into your lungs. For a long time, people thought that what happened there was that the measles virus infected the epithelial cells, which are kind of the lining of the lungs, the separation between inside and outside. It turns out that's not true. The first cells that they infect are these members of the immune system, dendritic cells and macrophages that live in the airway. They get into these immune cells. The immune cells then carry the measles virus to lymph nodes that are nearby. So they bypass that border. They replicate in the lymph nodes because measles uses a receptor called SLAM, and SLAM is there on professional immune cells, especially the cells that are responsible for immune memory. So it replicates in those cells, spreads throughout the body in the blood. This is all before you have a rash, before you have a runny nose or any kind of symptoms. Once it is widespread in the body, it goes, among other places, back to the lungs, enters the lungs. So by the time you start having symptoms, by the time the rash comes out and you start coughing and stuff, you have this huge viral load in the body, in the blood and now in the lungs, and you're coughing out just huge amounts of measles virus. And that's why it's so contagious. The other thing that happens is that because measles kills these cells that express SLAM, the most important cells that express SLAM are memory B and T cells. So you get measles, you become immune to measles for life. That's great. The problem is there's also this thing called measles-induced immune amnesia, which means that things that you've seen before, infections that you've had or things that you've been vaccinated against, measles kills the memory cells that are associated with that. So in the early vaccine trials, one of the things that people couldn't figure out was that if you went into a population and you calculated how much measles there was and you gave measles vaccine and you said, okay, we should see the death rate go from here to here, the death rate actually goes much lower than that. The measles vaccine overperforms in terms of preventing death. And what that's about is kids who get measles have some risk of dying from measles in the acute period right afterwards, and then have an increased risk of dying from other infections for about 3 or 4 years after that. And measles vaccine prevents both of those things.
This is why measles is so much more than just a rash.
Yeah, absolutely.
Right. And what makes it so dangerous, what I'm hearing from you, is that measles, what's special about the measles virus is that it's extremely effective at invading the body's like first line of defense, right? You mentioned those macrophages. And macrophages, just for our listeners, they're just like these powerful guard cells that like protect, especially like the lungs from like intruders from the outside world.
Exactly.
And that's kind of what's so tricky about measles in particular, is that it attacks the very system that it evolves to fight.
Yep.
So there was this really powerful quote from a pediatrician, Dr. Deborah Greenhouse. It's gone viral on Blue Sky. I just want to read this for some perspective here. Today I saw flu A, flu B, COVID, strep, seizures, cellulitis, migraines, asthma, and a swallowed penny stuck in the esophagus. And if you're not watching this, Dr. Ratner is nodding along. These are things he sees all the time. Okay, I know how to recognize these, test for, and treat them. They don't scare me. You know what scares me? Measles scares me, and that should scare you. For me, that was unbelievably powerful, right? And actually, I think I don't know how many doctors, pediatricians out there have actually seen measles. And unfortunately, we're going to start seeing more and more of this. Now, there's one other thing. I don't know if we spoke about this yet. SSPE, is that right? Can we talk about that? What is that?
So that SSPE is subacute sclerosing panencephalitis, and I will explain what it is in a sec. It falls into the category of these rare but really important outcomes. So when we talked earlier about how measles presents, like what a kid with measles looks like, and I said most of them get better over the course of a week or so, there are then the rarer side effects that can happen with measles. And, one of those is that kids with measles can get encephalitis, which is swelling of the brain, and that can lead to deafness or blindness or seizure disorders. That happens in about 1 in 1,000 cases of measles. About 1 to 2 per 1,000 kids with measles will die, which is horrible because it's a preventable disease. A higher percentage, about 10% of kids with measles will develop pneumonia, and that's a lot of the hospitalizations we see from pneumonia. And then there are the longer term effects of measles. We talked about immune amnesia, and then the other major one is SSPE, subacute sclerosing panencephalitis, and that is a degenerative neurological disease that starts somewhere around 7 to 9 years after measles infection. So the kids have gone 7 to 9 years thinking they were fine after the measles infection, and then it's progressive neurological worsening, loss of milestones, seizures, things like that. It is invariably fatal. It's fortunately rare. It happens somewhere between 1 in 1,000 and 1 in 10,000 kids with measles. The estimate used to be 1 in 100,000, but data from the Disneyland outbreak in 2014, 2015 suggests that especially in younger kids, it's more like 1 in 1,000 to 1 in 10,000, which is potentially a lot of kids.
Oh my gosh.
Yeah. I mean, one of the issues is that you talked about people not having seen measles lately, and that is certainly true. And that's something that we talk about a lot here, not just with measles, but other vaccine preventable diseases that may be coming back. But certainly SSPE is something that can get missed. It's not something we deal with much in the United States.
What happens with SSPE is the virus can stay dormant in the cells of the brain, in the neurons, for extended periods of time. And then just over time, over more chronic periods of time, right, it starts to cause this inflammation. And then high levels of inflammation in the brain can cause damage, especially when we're talking about developing brains.
Yep, exactly.
All right. So Undoubtedly, there will be people listening to this who say, okay, you're talking all about measles. Why aren't you talking about the harms of the MMR vaccine? So I want to talk about that a little bit. Just today, we posted a reel debunking a viral video put out by two naturopaths who are advising people not to get the MMR vaccine between 12 to 15 months. They said they were talking all about the high risk of febrile seizures, and they're also talking about neurodevelopmental delays and autism, which, I mean, we have dedicated full episodes and so many articles to that. I mean, we're not even going to talk about that. That has been debunked to death. But maybe worth talking about, febrile seizures. And this was my non-clinical take was, yes, there is a slight increased risk of febrile seizures, and no parent wants to see their child going through that, but they're typically benign and don't have long-term effects. And guess what? The virus itself causes them at a much higher rate, along with all kinds of other things.
And really quick, also, just for the folks that are listening, like, what is a febrile seizure as well?
Yeah, so a febrile seizure is what it sounds like. It's a seizure that takes place in the setting of fever. Most febrile seizures happen in children, especially young children. Most of the time they are benign. Sometimes you have a child who goes on to develop a longer term seizure disorder, who their first presentation is a seizure in the setting of a fever. But for the most part, febrile seizures are very benign. They're also very uncommon after MMR or any vaccine. They can happen, in the setting of anything that causes a fever. A small percentage of kids who get a measles containing vaccine can get a fever. A small percentage get a rash. Neither of those things is dangerous. And you are right, just to bring up the fact that, it's not a question of whether either the vaccine is 100% effective, which it's not, and no vaccine is, or whether it is 100% safe and lacks any side effects whatsoever. Of course, there's no medicine that can promise that. And, it's whether the side effects, which are usually pain at the site of injection. Some kids get fever, it's a low percentage. Some kids get rash, it's a low percentage. Whether those are worth the protection that you get. And I think, what we've been arguing here is the protection from measles is really important. And it's not something that you can necessarily predict that your child won't be exposed to over time. I'm sure that the folks who live in West Texas now didn't think that this was going to happen. Certainly all of us in New York City during that outbreak didn't think we were going to be dealing with the measles outbreak. The problem is that for the kids who came in after that, it's not like you have time. Oh, there's a measles outbreak going on. I'll just get my kid vaccinated now.
All right. So we are going to bring back a segment that we've neglected for a little while. The Heard from the Herd segment.
Heard from
Yes. So we received almost 2,000 questions when we opened up our question box.
Did we really?
We did. But I'm going to try to focus on the ones where I saw themes, patterns and questions. Something that we actually have already touched on this page, but we'd love to hear from you, Dr. Ratner. There is a myth circulating that vitamin A is a perfect substitution for the MMR vaccine. It's safer. It's just as effective. What say you?
I say no. So I'm happy to talk about vitamin A though. So vitamin A is interesting in the context of measles. Like, we all need vitamin A, as part of being alive. But it is, there were early observations that kids who were malnourished had higher rates of death and other severe outcomes from measles infection, which is not surprising and has been talked about in both pro-vaccine and anti-vaccine circles for a long time. There's a randomized trial from, I think, either the late 70s or the early 80s, looking at vitamin A supplementation and death during measles. And if you supplement vitamin A in populations that are vitamin A deficient, you decrease the risk of death from measles. You do not decrease it to zero, and you do not decrease getting measles or immune amnesia or any of the other things that go along with measles. But yes, so especially for kids who are undernourished, vitamin A supplementation is great. The recommendation in the U.S. right now is we certainly give vitamin A to any kid who is hospitalized with measles, with complications of measles. There are some clinicians, and I'm among them, who think that it's not crazy to give vitamin A supplementation to any kid with measles because it decreases the risk of some of these complications. But if you could only choose one thing, you would choose the vaccine because that prevents the infection from happening in the first place. So as I think with many of these kinds of rumors that circulate, like there's a kernel of truth in there. Vitamin A is a real thing.
It comes from something.
Yeah, it's something we think about with measles, but that's I think not the right way to think about it.
Are there any immune benefits to getting measles? I heard it can be protective against cancer.
So short answer, no. I mean, I guess you could say the one benefit of getting measles is that you are then immune to measles, assuming that you survive. But that's a stretch. There's no long-term beneficial effect on the immune system, and I would argue that there are potential long-term detrimental effects on the immune system, especially when you're thinking about things like immune amnesia. So, I'll leave it there.
No, I'm sorry. I was just going to say, so we wrote a newsletter on this. We partnered with a couple of immunologists. But so I guess this myth, this cancer myth, it stemmed from a handful of case reports from the early 1970s that documented temporary cancer remissions in a handful of patients following measles infection. But what they omit is that these remissions were temporary. In one cited case, the patient's leukemia returned after just 1 month and progressed rapidly until death. So certainly there is absolutely zero robust science behind this in any way. All right. Next thing, we're getting a lot of questions about MMR versus MMRV vaccine. What are the differences? Is one better than the other, safer? What say you?
Right. So MMRV is the MMR vaccine, the measles, mumps, and rubella vaccine, and the chickenpox vaccine combined. So those are all live attenuated viral vaccines. They work well together. They are safe together. The current recommendation, as I am recalling it, is that you can give MMRV for the subsequent vaccines. AAP, I think, recommends against MMRV, the combined vaccine, for the first dose, unless you don't have another choice for giving it. And the reason for that is just that there are higher rates of fever when you give MMRV than when you give them separately in younger kids. Again, the fevers are not dangerous. They're not like, I think if it's a choice between getting MMRV and not getting vaccinated, you would obviously get MMRV. Given the choice for that first dose, the AAP recommendation based on the safety studies that are done are separately for the first dose, and then it's fine to do them together for the subsequent doses.
Next question. Some questions about, are there any people who should not get the MMR vaccine? For example, I have an egg allergy. I have an anaphylactic reaction. Can I safely get the MMR vaccine? Are there any reasons not to get it?
So for any individual, you should talk to your doctor because the specifics of your allergy may be, it's worth discussing that in detail. There are some people who can't get the MMR vaccine. So people who have severe immunodeficiencies, because it is a live viral vaccine. We don't give live viral vaccines to people who have severe immunodeficiencies. Some folks with immunodeficiencies can get it. Pregnant people don't usually get live vaccines, and MMR is among those. And that's what, we've seen cases where people are pregnant, hadn't been vaccinated before a measles outbreak starts, and they're not able to get vaccinated. So it's good to check in advance of that.
It's so important for the people that can get vaccinated to do so, to protect those that can't.
Exactly.
And then to say vaccination is a team sport.
Yep, without a doubt. Yeah, I mean, we vaccinate to protect the kid who's getting vaccinated, of course, but we also vaccinate to protect the people around them. And then in terms of allergy in general, egg allergy is not a contraindication. But again, this is something to talk specifically about your allergy with your doctor. But for most things, as long as it's not a severe allergy to something that's in the MMR vaccine, you can get it.
So finally, we're getting a lot of really sad messages from people who are saying, I have a newborn, is too young to get vaccinated. They're panicking. They're very nervous. Some live in or, near Texas. What would you say? I mean, is there anything else that we could do to mitigate or, reduce risk? Anything you'd say to those parents?
Yeah, I mean, we talked about doing in an outbreak setting, doing the earlier doses, but there's no role for doses before 6 months. Kids who are under 6 months often have some protection from maternal antibodies that came across the placenta. It's often incomplete, and it's not something to rely on. I think that during outbreak times, it's hard. I would limit who you see. You might have to not see people in the direct outbreak area, certainly not see people who are unvaccinated who may be exposed, because the time that you're contagious with measles is from 4 days before the rash starts to 4 days after the rash starts. And those 4 days before are bad because you don't necessarily know that you have measles. Like you may feel like you have a cold or something like that, and then develop the rash later. And so that's one of that's yet another reason it's hard to control measles spread in populations. But the question is a hard one, and it's frustrating, which is why we prevent these outbreaks.
Yeah, I really feel for those parents. I mean, my kids are older and they're fully vaccinated now, but that's tough, especially if you live in that area. So there's no perfect answer, but to your point, I mean, I wouldn't be going to any crowded areas, any major events, especially if you're in that area. So the last thing for me, and then we can start wrapping up. I don't know if you have any final thoughts. One of the main reasons that we see as, people either delaying, spacing out vaccines or forgoing altogether is that parents are worried that it's overwhelming their child's immune system. How would you respond to that?
I mean, I think the immune system is good at handling large numbers of challenges, even all at once. And the vaccines that we give, almost without exception, are simplified versions of the pathogens that you may come into contact with. And so, like thinking about the hepatitis B vaccine, for example, if you give the hepatitis B vaccine, you're giving one single protein. It's the most important protein to make an immune response to, and it provides you with protection, as opposed to if you come into contact with the hepatitis B virus, there are all sorts of other proteins and things like that. There have been calculations of like how many antigens are actually in vaccines versus how many are in the diseases themselves. But there are, despite what some people put on the internet, there are robust safety studies. There are studies that the vaccines work, that they do not overwhelm the immune system, that they don't lead to any kind of immune diseases, and it's important protection.
So, and actually, just on that note, our vaccines have become a lot more efficient over the years, right? We've learned ways to actually reduce the number of antigens in vaccines through the use of things like adjuvants, which also come with a lot of myths and misconceptions, but they're so studied and deemed to be overwhelmingly safe. I don't know. I'm just sitting here, as a parent, as a public health scientist, like my heart is just breaking, watching what's going on, unfold in this country and the total. It feels like we're regressing. We're undoing so many decades of progress, and we're really taking public health and prevention for granted. So I don't know. This is just my moment of saying, like, I'm right there with you. I mean, you're on the front lines as a clinician. I can't imagine how you're feeling, seeing your patients in your office. But I don't know. I'm sure you're feeling a bit distraught as well.
Yeah, absolutely. And I think you asked for a sort of a final message, and I think that's the final message I would give, which is that we've made all of this progress in child health and decreasing child mortality, and none of that is guaranteed. Like kids who are born today, if they're not vaccinated, are just as susceptible to diphtheria or polio or whatever else as kids from 100 years ago or 500 years ago. And so it's, these things, with the exception of smallpox, which has been eradicated, these things can come back.
Right.
And it's, and we're starting to see that. And it's not surprising that it's measles first. It's measles first because measles is so contagious, but it's a warning sign of other stuff that's coming.
Oh my gosh. And it's like, what do we need to give people a tour of the cemeteries with the little baby tombstones? I mean, kids die from these things, and we have these incredible tools to prevent that. Even a single, as you said, 0 child deaths is the appropriate number of deaths. We don't want to see any. We can prevent this now.
Yeah. We should prevent every single one that we can.
In solidarity, Dr. Ratner.
Yeah.
Sarah, any final thoughts before I give a final plug for Dr. Ratner's book?
Give the final plug. That's good. Okay.
It does sort of seem to me that a lot of what people are very afraid of with regards to the vaccine are actually things that manifest with the disease itself.
Yes.
Am I wrong in saying that? Like,
yeah.
As far as like if they're concerned about neurodevelopmental delay or damage to the brain, I mean, we talked about the possibility of encephalitis. I mean, and how the measles virus can remain dormant in the cells of the brain for extended periods of time and cause chronic inflammation, which can, of course, damage the brain too, probably even more so than what would have in any other context. So I that's one thing that sort of baffles me about some of these claims is that, well, the disease itself would be worse.
Absolutely. I mean, you think about the MMR vaccine and the worry about autism, and we don't see congenital rubella anymore because of the MMR vaccine. Congenital rubella is a cause of autism. Like we had all of these kids during the big rubella outbreaks of the 1960s who had forms of autism that were caused by congenital rubella. We don't see that anymore. Of course, we still have kids with autism from different causes because autism is complicated. But I don't understand that though. I don't understand the sort of cognitive disconnect there.
Well, 3 cheers for the MMR vaccine and to Dr. Adam Ratner. Please go out, pick up a copy of his book, Booster Shots. It is incredible. We will link to it on our show notes. Thank you so much, Dr. Ratner, for joining us today.
Thank you so much. This was great.
Yeah, thanks, Dr. Ratner. I mean, just another plug for the book. I mean, this guy has such a real gift for making something real complicated, like break down into something that's very easily digestible. Like anyone could pick up this book and like understand what measles is. And virology and immunology are like 2 of the more complicated branches of science, I would say. So to be able to do that is a real gift. So thank you for joining us, Dr. Ratner. We really appreciate it. And with that, I would like to thank all of you for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.